going to be talking to you about topical anesthetic and some adverse reactions about it as well. In the last couple of months, I had 3 or 4 patients that has come to me and told me how they were asked to apply their own anesthetic from home and then come into the clinic, whichever clinics they went to. I was pretty shocked by that, and that's when I thought that I should, after I've heard a few of them telling me that, I then thought that I should do this video for my patients, my clients, and so you all know what to expect and what to do. I never asked my clients or patients to apply their own anesthetic from home at all. They can apply their own anesthetic if they choose to at the clinic, but under the supervision of a qualified therapist or a practitioner. There is nothing wrong in applying your own anesthetic, but it has to be done under the supervision of somebody who is qualified. Just in case if you apply it and it goes into your eyes or your tongue, or it can have some complications, and they would know what to do. And in saying that, there are so many forms that you can also fill, and the consent forms that we also do here as well is the for the practitioner to apply it for you. And by them doing it, they know that the areas that they are treating, and they will be applying in those areas, and it is much safer for them to apply it for you if you give them the consent to do it, which I suggest would be the best way to do, because knowing that they know what they're doing. Also, these people who were asked to do it, they had to actually drive to the clinic after applying their own anesthetic, and some had to drive 45 minutes, another person had to drive half an hour, and then another one was around 15 to 20 minutes. But in saying that, depending on what medication you are on and your medical history, there could be so many complications that can happen. Okay, and if it goes to the central nervous system, you can have palpitations, you can have dizziness, you can feel lightheaded, you can feel confused, you can also have muscle twitching, convulsions happening. There's so many things that can happen depending on how long it's on there for. And when you are driving and there's traffic jam as well, you don't want it to be there longer than it's supposed to be there, right? There are a certain time frame that it should be on there. And while you're in an environment of a clinic or surgery, then they know what they are doing. They time it. They make sure that you're not touching it, you're not itching your skin or putting your fingers into your eyes so that the anesthetic doesn't go into your eyes or your tongue, things like that. It is very, very important to know all these things. Some people can also get like chest pain, which is like, if they have some cardio problems and things like that. And it all depends on which areas you are doing it on and how much of the anesthetic is being used. Okay, the practitioners and the therapists know that how much they need to put on and which areas they can do and how many areas they can put on. Okay, my suggestion to you is that if you do get asked by any clinic to put your own anesthetic, before you get there, or put it from home so it saves them time, just deny it. Just say to them, no, I refuse to do that. And if you really want me to do it, I'd like to come in here at least half an hour early, and I would like to do it under the supervision of a practitioner or a therapist or aesthetician. You know, it is advisable for you to do that, and you have the right to ask for that. Nobody can say no, and if they do say no, that means that you are at the wrong place. And it is just something that popped in my head after hearing this from a few people, that they have been asked to apply from home, and I was very concerned that you know, while driving, what if they got confused, what if they had it in their eyes, what if they touched their tongue, what if, you know, anything like that, because there's always some percent of things can go wrong, right? So driving with that on is just a no, okay? We are not just qualified practitioners here. We are not just, we have done the anesthetic courses, and we know that there are so many complications that can happen, and there are so many forms that you need to fill in. You have the right to say to the therapist or the practitioner that I would like you to apply it for me, because, you know, I don't want to apply it just in case if I don't apply in the right places where it's needed, because they're the ones treating you. They know what they're, you know, which areas they're going to be doing the needling or whatever they are doing to you. There's so many things that we do that we need anesthetic. So when they are doing it, they need to, you know, do it themselves. It's best for them to do it themselves, but there are consent forms that you need to sign for them to do it for you. So yeah, I hope this has helped you guys, and if you do go to any place that asks you to apply it yourself from home, just say I'm sorry, but you know, I would like you to do it for me, or I'd like to do it under the supervision of someone qualified. I hope this has helped you guys, and I shall see you guys in the next video. Bye.